Hi everyone, welcome to researchmd.com. My name is Dr.Pramil Cheriyath, and we're going to tackle a very important term and a topic in biostatistics and the diagnostic. If you are a clinician, I think it's very important for us to know that, okay? The term is going to be, we're going to be talking about likelihood ratio. Again, my name is Dr. Pramil Cheriyath. I work as a program director, a director of research, and I'm also an assistant professor of medicine at Hackensack School of Medicine. So let's get into likelihood ratio. So let's look at the definition of the likelihood ratio. Likelihood ratio is the likelihood that a given test would be expected in a patient with the target disorder compared to the likelihood of that same result would be expected in a patient without the target disorder. Now, let's convert that into a layman's term, which is likelihood ratio will tell you what is the chance of you're going to have the disease or not. Okay, there's two types. One is positive likelihood ratio, and then negative likelihood ratio. So you can use this to interpret diagnostic tests or the symptoms and come with the post-test probability, which we'll be talking later on. So let's show some of the formula, how we can calculate the positive likelihood ratio. Okay, so in order to calculate the positive likelihood ratio, which is the probability of a positive result in a patient with the disorder divided by probability of a positive result in a patient without the disorder. Okay, so it's actually the simple way to know, remember, is sensitivity divided by 1 minus specificity, which is actually true positive rate divided by false positive rate. Okay, now let's look at the negative likelihood ratio. Negative likelihood ratio is probability of a negative result in a patient with a disorder divided by probability of negative result in a patient without the disorder. Okay, so the formula is 1 minus sensitivity divided by specificity, which is actually false negative rate divided by true negative rate. Okay, now let's look at, we just kind of use this likelihood ratio to find out what are the chances you can have a disease when you have some particular symptoms, or depends upon the test results. Okay, that's why we have to express in some kind of percentage. So in order to express your odds, it's important to calculate some more terms we need to know: the pretest probability and the post-test probability. Okay, so what is the pretest probability? That's prevalence. Let's say, the diabetes prevalence is like 5% in the population. So your pretest probability is always going to be like 5%. Okay, remember that. So the next one, now we have to convert this pretest probability using the likelihood ratio. We're going to convert it into a post-test probability. That is the probability that patient has the disease estimated after the test results is known. So again, let's look at the post-test. In order to calculate the post-test probability, first we need to calculate the post-test odds of a disease. So that is actually, you take the likelihood ratio and then multiply by pretest odds of the disease. Okay, and then post-test probability of the disease equal to the post-test odds of the disease divided by 1 plus post-test odds of a disease. Now, there's a great nomogram. If you do Google searching, we find the nomogram, and then you have 3 columns. One is the pretest probability, then you put your likelihood ratio, then you had the post-test probability. Okay, so first you go to the pretest probability, which we already talked about. The pretest probability is the prevalence of the disease. Okay, then you put an arrow, and then you find on the likelihood ratio, you cross that, and that will make you to the post-test probability. A nice nomogram, we could use it. So if you can download it from the internet, that would be great. So let's convert some of this likelihood ratio into bedside estimate. So if somebody have likelihood ratio of 10, that means the probability of having the disease can go up like 45%. So if it is like 5, we can say like a 30%. If it is 2, which is around 10 to 15%. If it is 1, it's not significant, that is 0, right? Because it's a ratio. Anytime 1 divided by does not matter, no significant effect at all. Now we're going to look at something, term called a negative likelihood ratio. So let's say it's 0.5. My odds of having the disease go down by 15%. If it is 0.2, it go down by 30%. If it is 0.1, it go by like minus 45%, okay? So we have this nice scale, we made it, looking at the probability and the likelihood ratio, okay? On the right side, we have positive likelihood ratio. On the left side, we got negative likelihood ratio. So if you look at it, chest pain radiating to the both arm, and somebody into the emergency room, or somebody tell you, look, I'm having pain just radiating to the both shoulders, my likelihood ratio is close to almost 10, okay? That means my probability is going to go up almost like 45%. So that's on the right side, positive likelihood ratio. Now we look at the left side. If somebody come up to you and said, when you say pleuritic chest pain, that means when I take a deep breath, it hurts. The negative likelihood ratio is 0.2. That means your your probability is going to go down by 30%, okay? Now we do some calculations. We talked about, the pretest probability, how to convert into post-test probability. That's also very important, okay? We know, let's look at the cardiac chest pain. If somebody come to the emergency room with 100 people with chest pain, 5% of the people can have like cardiac chest pain. So our pretest, you can just estimate like pretest probability of chest pain before you walk into the room, it's around 5%, okay? So now first thing we have to do is, first you have to convert that into post-test odd, and then you convert that into a post-test probability, okay? So first thing we're going to do is convert that into post-test odd. So you take the likelihood ratio. We already know the likelihood ratio of pain radiating to the both shoulder is a positive likelihood ratio, is around 9.7. So we take the likelihood ratio and multiply by pretest odd, which is the pretest probability. We got 9.7 into 0.05, which is equal to 0.485, okay? That's our post-test odds. Now we have to convert that into post-test probability. How do we do that? Post-test odds of the disease divided by 1 plus post-test odds of the disease, okay? Again, the formula is post-test odds of the disease divided by 1 plus post-test odds of the disease. So we take the 0.485 divided by 1 plus 0.485, which equal to 0.485 divided by 1.485, which you give a probability of 32.6%, okay? So the post-test probability with a likelihood ratio of 9.6, somebody said, I have chest pain ready in the both shoulder, it could go up to almost like 33%. Remember that. From 5%, you see the jump to almost like 33%. Now, another person come to the emergency room or somewhere and tell you, I'm having chest pain, and when I take a deep breath, it hurts. That's like almost like a pleuritic type chest pain, okay? So now we have a negative likelihood ratio, which is 0.2. That is a less than 1, it's a negative likelihood ratio, 0.2. First again, remember the two steps you have to do. First you have to convert this to post-test odd. So we take the likelihood ratio, multiply by pretest odd, you get 0.2 into 0.05, which is equal to 0.01. And then post-test probability is, again, we talked about post-test odds of disease divided by 1 plus post-test odds of disease. We get like 0.99% or like 1%. So we decreased our odds from 5% to like 1%, okay, using our negative likelihood ratio, okay? Again, thank you so much for watching. We will be back later on with another presentation. Please subscribe to our channel. It would be very helpful. Thank you again.